My name is Jeffrey Stephen Borer. I am a physician, and I'm professor of medicine, cell biology, radiology, surgery, and public health at the State University of New York Downstate Medical Center in Brooklyn, and also professor of cardiovascular medicine in cardiothoracic surgery at Weill Cornell Medical College in Manhattan. If I had to summarize in a phrase the thrust of what I do that I think is particularly important to me, I would say that I attempt to achieve the goal of creation of new knowledge, because that's what research is. Research creates new knowledge. The data that you collect is the new knowledge, or are the new knowledge, and that's what I do. I'm an academic cardiologist. Thinking back, it's hard for me to know why I do what I do, but when I was in college, my father convinced me that going into medicine was an appropriate thing to do. He had several reasons that sounded pretty good at the time. None of them are correct or relevant now, but I didn't know that when I was 16 and just starting college. However, I made the decision. I took the courses that were necessary to be able to apply to medical school, in addition to the courses for my field of concentration, which was government. Then I went to medical school. Now, it may sound unbelievable, but I had no idea that there was a difference between doctors who practiced, who were in private practice, what we now would call private practice, and doctors who were teaching in a medical school or doing research. I didn't know there was any difference. It's really extraordinary that I could have been so naive and so ignorant, but I was. And so I started medical school, and these people came in to give us lectures, and they were wearing white coats. And I thought, well, if these are the people that the school is sending us in to teach us, then they must be the best people in the school, and I should try to be like them. And so that's what I did. I never gave any thought to doing anything but joining a full-time faculty of a medical school and doing research and teaching and seeing patients, all those three things as part of the program. And so that's what I did. If you decide you really want to achieve something that will have an impact on a lot of people, you have to work very hard. You have to be willing to sacrifice certain things because you can't do everything. You have to be willing to sacrifice, and you have to think about the importance of those sacrifices and whether the achievement at the end is worth the sacrifice. And most importantly, whether you are treating the people who you care about properly while you're attempting to gain your achievements. My family is very supportive of what I do. They have allowed me and allow me to go off traveling to give lectures or to have learning experiences or what have you. And they seem to understand that this is important to me. I believe I probably overdo it sometimes, and I feel badly about that. But most importantly, I have the sense that my family loves me, they care about me. And that's the support I need to go on and do what I do. Well, who will I leave my legacy for? First of all, for my family, if they're interested. I hope they would be. And also for my patients. I didn't speak much about the relationship with patients that I've developed over the years, but I do see patients. I see outpatients 2 days a week. I see inpatients 1 day a week. And many of these people I've been seeing for as long as 35 years or longer, and have become quite friendly with. So I would say that's an important part of what I do. It's important to me. I see these people because I like them. While developing radionuclide cineangiography certainly was the pinnacle of my scientific career, the most important things that I've done really have been working with the health authorities, the regulatory authorities, the FDA and the ISO, because the impact of what these regulatory authorities do is so great. The first was marrying my wife, without question, and we have 2 children. They're both grown now, and 1 grandchild who's 19 months old now. The family is certainly the most important personal activity. But in addition, I enjoy other things. I enjoy theater very much. I began going to the theater when I was in junior high school. And soon, because it was easy to get there from my home in Brooklyn, taking a subway to Times Square and finding a theater to go to, I could do that every weekend. And I began going to the theater once a week, every week, for many, many years. I don't go quite that frequently now because my schedule is a little too congested, but I love going to the theater. When I say I'm going to do something or I believe in something, people should be able to believe that what I say is true. I'd like to be remembered as somebody who made an important contribution in medicine, but that's not quite as important as being recognized as an honest person who can be trusted, who's good to his word.